I think we can go live to the Health Secretary, Matt Hancock, now, who's just sat in his seat for us and he's got his mic on. Oh, he's stood up.
Outside.
Thank you so much. You're outside. Good morning to you, Matt Hancock. I hope you can hear us.
Good morning.
Good morning.
Yes, loud and clear, yeah.
Yes, good. So, as you've probably just heard, we were speaking to our doctor, Dr. Amir Khan there, and all morning we've been talking about the risks and the benefits of the vaccine, and we've had lots of questions from viewers, and lots of them have been answered this morning. From your point of view, you obviously have behavioural scientists who work on stage and talk to you about these things. What do they tell you about the impact on people's behaviour and confidence that this kind of change in advice would have, even with all the caveats that have been given about the ratio of risks of COVID versus risks of the vaccine? Because the statistics are there, the facts are there, and the change in advice is there. What you want is for people to not necessarily change their behaviour, I'm assuming.
Well, that's right. The transparency is critical. You know, we take this approach of total transparency, letting everybody know these risks, even though they are extremely small, 4 in a million chance. And the reason for that is because we want people to have confidence, and I think people can take confidence in the vaccines because they can see all of the facts that we can see. And as your in-house doctor was saying just then, the benefits clearly outweigh the risks. The vaccine is safe, and we know that it's effective and it's saving lives, but we want the programme to be as safe as possible, and that's why we're taking the approach that we are.
It's frustrating, though, isn't it? Because no matter how hard you keep trying as the government and as our ministers in charge, and no matter how hard as our in-house doctor, as you described, Dr. Amir or Dr. Hillary, when he's here as well, to allay people's fears, every time there is another change to how the vaccine is delivered or the ages of the people that get the vaccine, it brings into question this connection between the blood clots and the AstraZeneca vaccine. How much of a blow is this? How frustrated are you by that, Matt Hancock?
Well, I'm not, because I think this transparency is important, and we haven't seen this problem yet, as in the uptake amongst the over 50s for whom the vaccine is available at the moment is amazing. Over 90%, 9 in 10, and in fact for the over 70s it's over 95% of people are taking the vaccine. So the uptake is absolutely spectacular. The number of people coming forward for their second jab was over 99%. So of course we want that to continue. But rather than hiding
that will slow down, though, of course?
Transparent.
I mean, are you concerned that that's going to slow down? Because it's the under 30s that are now being told that they will be offered a different sort of vaccine.
Well, there'll be some time until we get on to vaccinating all the under 30s. And if you're under 30 and watching this, what you can take away from the decisions that we've made in the last 24 hours is that we will make this as safe as possible. Even though this risk is approximately the same as the risk from taking a long-haul flight, we're going to make this as safe as we possibly can for you, and therefore you'll have the choice of having a Pfizer or a Moderna jab. But if you've had the AstraZeneca vaccine already, then it's incredibly important to come forward for the second dose, because there is no evidence of this impact from second doses, and we've now done over 5.5 million second doses in this country. So when you get the call, get the jab, and we will make sure that it's done as safely as it possibly can.
How do you bridge the gap between those people here who are looking across the channel and look at what's happening in Europe with regards to the AstraZeneca jab? Because we know that there are about 4 countries that have said that they don't want to use it at all, and then there are a plethora of other European countries, our nearest neighbours, who have said that they don't want anyone under, say, 55 to take the AstraZeneca jab. Then somebody here will be like, well, I'm in my 40s, and why is it okay for me here to have the AstraZeneca jab, but the politicians and the scientists just a couple of hours away are making very, very different decisions about the exact same jab? That is, I think, where the increased worry and concern will lie.
Well, we've seen this over the last several weeks, in fact, a couple of months, and it hasn't had any impact on the uptake here. At first on the continent, some countries said older people couldn't get it. Now some are saying that younger people shouldn't get it. The European regulator says that it is safe. The World Health Organization says that all 3 vaccines that we're using in the UK are both safe and effective, and our regulator here has clearly said the same as well. You say that some people in their 40s might feel like this. I'm in my 40s. I'm looking forward to getting my jab, and I'll take whichever one I'm offered, because it is the benefits far outweigh the risks. We know that, and we can see that in the data we've published this morning, showing that the links from cases through to hospitalizations and deaths, that link is breaking because of the vaccine.
Lots of our viewers this morning getting in touch saying they've had their first dose of the AstraZeneca and they are now concerned and they would rather have a different vaccine for their second dose. Will that affect how secure their vaccine is if they decide to take a second dose? Can you request to get a different dose?
Well, no, because we haven't got any evidence of that. We're trialling using one dose first and then a different one second. But that isn't approved because we haven't trialled that at all, whereas we have done millions of second doses of AstraZeneca and not seen this effect. So the second dose of AstraZeneca is safe. It's the recommended thing if you've had AstraZeneca first. If you've had Pfizer first, you can get Pfizer second. That's what's been done millions of times.
So that research that you're doing now, when will we expect to get the feedback on that research? Because that would allay a lot of people's fears this morning, waking up thinking, I just don't want to take this risk. And if I can use a different vaccine to try and complete get the total coverage, then I'd much rather be able to do that.
Well, that'll take some months to conclude because, of course, you've got to wait the 12 weeks in between the doses to see to be able to conduct that sort of trial. So it's underway, but that is not a tested, it's not a tried and tested method. What is tried and tested, if you've had the first jab, is getting the same jab for your second dose, and that's what people should do. The medical evidence is really clear on that.
And Matt Hancock, with so few, it seems, care home workers having taken up the jab so far for many different reasons, we've talked about whether it should ever be compulsory, and that is ethically hugely controversial, but would it not being made compulsory damage us coming out of lockdown, and how would that work if it's not compulsory? Do people have the freedom to not have it and keep their jobs in, say, care homes?
Well, the good news is that we've now reached 80%, so 4/5 of care home workers who've had their first jab, which is a really solid progress, good increase.
And is that enough for you? Is that enough?
Well, we haven't made a decision to make this jab a condition of working in care homes. What I'd say to anybody working in a care home is the jab is safe, and it not only protects you, but it protects those who you have a duty of care towards. So I understand why many care homes want to make this a condition, want to be able to say you've got to have the jab to work in this care home, because they care about the people who are in those homes. But we haven't taken that decision, and as I say, now 80% of people in care homes have had their first jab, and that number keeps increasing.
And if an employer in a care home refused to employ somebody who hadn't had the vaccine, would you support that decision?
Well, that is a matter for the employer and employment law. And so rather than a matter for me as a minister, that's about the individual employment relationship. What I care about is as many people as possible getting the jab, because we know that it's safe, we know that it's effective, and we're taking a safety-first approach, as you can see from the decisions that were made yesterday.
And we want to find a way out of lockdown, don't we? We want to get out of the pandemic. Lots of people talking about that. There's one study that suggests that come Monday the 12th, we could reach herd immunity with enough people having had at least their first dose of the vaccine and then having come into contact with the virus. I know that you're facing a legal challenge from hospitality leaders that was expedited in the High Court yesterday to try and explain to them why indoor hospitality isn't going to be allowed to open with non-essential retail. It's a hugely, hugely important part of our society. It's a hugely important part of our fabric to have that retail open. It's a fair question as well, isn't it? Why non-essential retail, which is indoors, will be open, and yet indoor hospitality, where we know how seriously restaurateurs and bar owners have taken the provision to protect people against the spread of the coronavirus, how seriously they've taken it, their frustration at not being open at the same time.
Well, we've set out the roadmap, which clearly states how we think we can get out of this safely and irreversibly. Our goal is, not to have to reverse any of these decisions. That means that we're taking each step, one step at a time, and then seeing the impact of that step. First, starting with the schools going back, and then on Monday, opening pubs and hospitality for outdoors, and opening the shops, non-essential retail.
Yes, so what is the difference then between the non-essential retail and indoor hospitality?
Well, the one is for the purpose of socialising, and the other is for the purpose of buying clothes or whatever it is that's for sale. And so the very purpose of hospitality is to get people together, and sadly one of the awful things about this virus
is exactly what happens with indoor retail as well. They're both described as pastimes as well. Shopping is one of the most popular pastimes that we have in this country. People will go into shops to be able... I know one of the things that lots of my friends are really excited about is being able to wander around shops and just look at some of the things that they can now buy. No different really is that they'll be getting together to do that, just as someone will be in a very safe and strictly contained environment in a pub or a restaurant.
No, they're completely different, because one has the purpose of going in shopping and the other has the purpose of going socialising. And more importantly, though, we have to take these steps carefully. The reason that we're just not reopening everything all in one go is because we want this to be careful and we want to make it irreversible. And that's why we have a roadmap, that we're given the indication of when we think we could take steps, but we're checking the data, seeing the impact. So far, we're on track. It's going well, and the vaccination program is on track, and we're well placed, and we're going to meet our target of making sure everybody gets the offer of a vaccine by the end of July, all adults.
Yeah.
And we've set the roadmap out. It has the very strong support of Parliament. And that's the approach that we're going to take.
OK, we're going to have to leave it there, but we appreciate your time at Hancock. Thanks for joining us.